Hi, my name is Abubaker and this is the last part of the series of transcystic CVD exploration, as requested by some of you. So this is what I use. It's a cook set. You don't have to use a cook set. It costs about $800, and I'm going to show you some ways to kind of get a little bit cheaper. But when you do the math, how much this costs plus the disposable transcystic, we're talking about $1,800. And you look at performing ERCP, anesthesia, and additional hospital stay, possible complication of pancreatitis. I think this is 100% worth it. Again, I'm going to show you some ways to kind of become a little bit cheaper. So can you zoom in here? The common bile duct exploration set is consists of a balloon. It's a 5 French balloon, 40 centimeter long. It dilates to 8 millimeters, and the whole purpose of dilation, you're dilating the cystic duct, you're not dilating really the common bile duct. That's why if the common bile duct is less than 8 millimeter, you do not want to use this balloon, because part of this balloon, despite you dilating the cystic duct, because it's about 4 centimeter long, the balloon is 4 centimeter long, some of it is going to be in the common bile duct, and you don't want to really dilate the common bile duct to cause any kind of injury. And the purpose behind dilating the cystic duct is to break the valve and create enough opening so you can remove up to a 8 millimeter stone. So if you have obviously bigger than 8 millimeter stone, you have to extend the cystic duct ductotomy to the common bile duct to kind of remove those stones. You also have an introduction set. There's a wire, a 0.35 wire that's 145 centimeter long, a 2.4 French extraction basket, and a 3-way valve. So typically you want to have over here. Typically you want to have a separate Mayo, and you're supposed to have this set open completely on the Mayo. You're also supposed to have this what is it called? The pressure thingy. I call it the pressure thingy, but this is what's called. All right, and you can actually gauge the pressure of how much you're putting inside of your balloon. All right, and cholangiogram catheter, depending on how big your cystic duct is. You can I have 4 French and 6 French cholangiogram catheters. I also use them to irrigate the cystic duct and common bile duct. Okay, so you only need one. You can also use a forwarding balloon. I stopped using a forwarding balloon where I can kind of pass the forwarding balloon and try to clean the stone. It's just a waste of time. Just go ahead with a choledocoscope. It's faster and much more efficient. Okay, so I'm going to start opening and show you what the steps are. And this is all expired stuff, so we're not wasting any money here. I'm going to put things up here. Can you focus here? Right. So the first step is getting this needle, all right? And this needle, I'll take my shirt off, but Yusuf will block me. I'll show my 6 packs, but anyway. So you want to really go, not too anterior, not too lateral. You want to kind of go like somewhere where you kind of align with the cystic duct. I've done so many that I kind of know what angle the needle has to come in. So you put in your needle again. If you're retracting the liver and the liver is so short that's coming above, you might have to kind of go between the rib cage. All right. You put your needle in, and after that you grab your J wire. This is called a J wire. Has a flimsy tip. You pass the J wire through the needle. All right. And if you're not sure if your angle is correct or not, before you commit, pass that J wire a little bit more and see if it comes with a cystic duct with a right angle without having to kind of flip it to kind of get into the cystic duct. It has to come with a right angle. Like, not the correct angle, not the right angle, a correct angle, okay? Once you're happy with that, if you're not happy, just take it out, stick the patient again, and pass your pass the wire again. Once you're happy with the angle, take the needle out, make a small nick right next to the skin. Once you do that, you're gonna bring your dilator. All right, the dilator usually comes flipped sideways like this. You take it apart and introduce it correctly. All right, and this is about it's a 12 French. It's a 12 French. It's a 12 French catheter and a dilator. So if you want to use a vascular, I tried to kind of use a vascular when they were in back order. It's more expensive. Another option, a cheaper option, you can use a 5mm trocar. However, when you use your choledocoscope in your balloon, you're going to have a lot of air escaping. So you can use a pediatric trocar, a 3mm pediatric trocar. It's much cheaper. All right. So once you do that, you make a nick on the skin. You have to make the nick on the skin, otherwise you're going to bend this. All right. This is a dilator in the sheath. You pass the dilator in the sheath. All right. Dilate. Once you dilate, then you remove the wire and the dilator, leaving the sheath in place. The whole purpose of the sheath, it will give you a trocar or an insertion site where you can pass your balloon, you can pass your choledocoscope, all that stuff. And again, it's a 12 French catheter. And remember, each French is equivalent to 0.3 of a millimeter. So 3 French is equivalent to 1 millimeter. 12 French is about 3mm, a 3mm catheter. Once this is in place, all right, the next step is to kind of bring your balloon. Can you focus here on the balloon? The balloon has 3 ports. It's a distal port and a balloon port. The balloon port is where you inflate. You connect your inflator, all right, and you inflate to the required pressure. If you forget what the required pressure is, it's on the, it's up here. It's up here to 5 atmospheric bar. You can go up to 15. I've never had to go up to 15, but I only go to 5 and I leave it there for 3 minutes. And again, it goes through a balloon trocar. All right, you don't really need this. You can connect it directly. I've never had to use this. So you connect the balloon, you lock it for 5 atmospheric bar. Once you do that, you leave it for 3 minutes. And while you're inflating your balloon, while your balloon is inflated, I'm just going to inflate the balloon here for a demonstration purpose. And to do that, I'm going to have to use this to kind of lock the air in place. You can see the balloon here. It's a soft balloon, okay? You don't really want to use a rigid balloon if you're using a vascular balloon. And you want to, part of the balloon has to be outside of the cystic duct. Again, I cannot emphasize this enough. The purpose is to dilate the cystic duct and break the valves inside of the cystic duct, okay? And you want to do this over a wire. So once your catheter is in place, you're going to bring your 145 millimeter, 105 centimeter wire, and the tip is very soft. It's very hard to injure the cystic duct or the common bile duct using this. So you're going to pass it. You're going to pass it through the sheath here. You're going to pass it through the sheath into the cystic duct to the common bile duct. I do this blindly. I don't use fluoro to do this. Once I'm kind of know that I'm in, how do you know that you're in the common bile duct or you're in, you know, it's just a visual thing. You kind of know that you're in. Once you're in, on top of the wire, using a cylinder technique, I'm going to deflate the balloon here. Using a cylinder technique, you're going to pass into the cystic duct, okay? Again, the whole purpose, dilation of the cystic duct, not the common bile duct. Once you do that, inflate it, and once you inflate, if you want to shoot another cholangiogram, you can use the distal part. I'm going to show it to you here. You can shoot contrast. It's a little bit harder with a wire in place, so you can pull out the wire if you want to shoot a cholangiogram, but I'm assuming at this point you're ready to your cholangiogram performed, okay? But you can take the wire out and shoot your cholangiogram. Once you're happy, to be honest with you, I've never had to shoot cholangiogram. The balloon, I kind of know I'm going in and I know where I am, okay? But if you want to do that, you can shoot a cholangiogram. It works really well, okay? Once that's done, you dilated your cystic duct. It comes to the part where you have to use the choledocoscope and kind of go in. Anesthesia on top has to have glucagon. It comes in 1 milligram vial, and I usually have them have 2. I also have them have morphine just in case I dilated so much and I can't retroflex to see the common hepatic. I give about 4 milligram morphine to constrict the sphincter of Bowdy and have retroflexion of the contrast up to the right and left hepatic duct. All right, so everything again is set on your Mayo table. So let's talk about the scopes here. I'm going to move it here. I have. This is the scope I use now. It's by Boston Scientific. Again, I don't get paid by Boston Scientific. This is a ureteroscope. It's an HD ureteroscope. And this is all you need from it. All right. And this is a choledocoscope, the one I used to use in the past. All right. Let's compare measurements side to side. You can see that the ureteroscope is longer than the choledocoscope. All right. And the other thing is that the choledocoscope, when you turn it all the way to the left and all the way to the right, that's all it's giving you. It's almost like, I'll say about 110 degree turn. You don't need that much, but that's all you get. Compared to a ureteroscope, when you turn it, almost give you a 360. Again, you don't need that exaggeration of a turn. So you dilated your catheter, your wire's in place. What you, before we go there, let's talk about the setting of the choledocoscope. Where's the camera?
It's already in there.
Okay. So when we're doing this portion here, you want to connect your choledocoscope. It's either the operator can look with their eye, and that's very annoying because I work with residents, I won't be able to see what they're seeing. So we have a striker system. We connect the striker system up here, connect it to a light source, and the light source that we use is the same light source. This is it. It's the same light source that some people use for their headlight. You just stick it in there. It will give you the light, and you go in and you perform your choledocoscope. You pass it over a wire like I showed in my previous video. The most important part I want to show here is that how you hold the scope. When you hold the scope, don't hold it with the with this portion of the scope bent. You want to hold it straight, all right? And when you rotate, you want to rotate right and left. You rotate your wrist. Here, the rotation is here. It's not here. Some people try to rotate it here. They'll break the fibers. If you're using a scope like this, which is reusable, you don't want to hold it with a robot because you can break the fibers, and repairing is very, very expensive. I mean, CSP, they do their due diligence trying to break it themselves, so don't help them out. So don't hold it with a robotic instrument. And again, you really want to have your arm all the way up and you're rotating your wrist. Are you showing my wrist? You're rotating your wrist.